most common issues that I see are PCOS. It stands for polycystic ovarian syndrome. So it's sort of a spectrum of hormone dysfunction, but basically if someone has passed that year mark of after starting their period and their cycles are still irregular, PCOS is really like the first thing to probably look at. So PCOS, it's a little complicated to explain the hormonal changes that happen, but basically the period isn't regular. So it can be sometimes just a little long, the cycle, like 35, 37 days. Sometimes it's really long, like they don't get a period except for like once every 3 months or 6 months or once a year, right? Like, and it's not, they're not on birth control. There's no reason, right? So then again, you're kind of going to the why. And unfortunately, PCOS is really common these days. And most of the women that I work with, it's been that way since they started their period. So, back to kind of what Dr. Gordon said is I hope to just empower parents that like, if your daughter, has passed that year mark and her cycles are still irregular, start asking the why questions, right? I mean, it might just be her body's normal, or have to do with something else, but I just see so many women that, this started many, many, many years ago. And there's a lot that can be done for it, particularly in naturopathic medicine. So again, the conventional answer is generally birth control, because that will regulate the cycle. It totally manipulates the hormones. But there's a lot more that can be done to support the whole body, because PCOS comes with a lot of other hormonal imbalances. So it can cause, blood sugar issues, insulin issues. It can cause cholesterol, just overall higher levels of inflammation in the body. Sometimes it comes with carrying excess weight. Sometimes it doesn't. And then it can also cause increased testosterone and DHEA. So, earlier we were talking about testosterone, and some of the classic things you see with that are like acne, right? Irritability, excess body hair, especially like places you don't want it, right? So particularly if you're seeing that paired with irregular cycles, it's like, okay, PCOS is probably happening here. So that's something I definitely, I'm always asking patients about, getting a lot of information and diving into looking at labs. And there's certain things you can see on labs that we don't need to go into necessarily today. I also see endometriosis. So endometriosis is more of like an estrogen dominant condition. It's definitely multifactorial, but it's those people that you might know who have really like debilitatingly painful cycles. Like they call out of work,
10.
Yeah, like they're like, they can't, and think about that. I mean, hopefully it's, nobody listening to this, but I bet you probably know someone like they can't do anything the first couple days of their cycle. And that happens every month, right? And that's just like, it's so sad to me that, something that's just a part of our hormone cycle is having such a negative impact on women. But that's another, relatively common one, and that can have implications for fertility as well. It tends to impact egg quality. PCOS can also impact fertility, again, like if you're actually looking at having children, because the cycles are regular, right? So you got to know when ovulation happens to get pregnant. There's a lot that can be done for both, but endometriosis is another one that I see. I will sometimes see amenorrhea. So that's essentially the absence of a period. So, once the period has started, and you're kind of past again that window of when it should be regular. If you don't have a cycle for extended periods of time, again, one, you're going to be looking at PCOS, but you may also be looking at other hormonal either imbalances, potentially, low body weight, low or
hypothyroidism,
yeah,
pituitary,
like all right, like again the why, right? Like so let's not just start them on birth control, because that could fix all of these things, right? Like as a band-aid, but then it's like we don't know why, right? So that's another one that I see frequently.